All right. Well, back with Dr. Beck. Dr. Beck, lots of people go to a podiatrist for heel pain. And I have heard that physical therapists and some type of muscle and nerve conditions are very much, can work with that too. Shed some light on.
Well, heel pain is a really common problem, particularly in my practice, and I think a lot of people's practices, their feet hurt. And one of the common conditions I see is called plantar fasciitis. And this is, again, another condition where we treat conjointly with the physical therapist. I provide the medical aspects of it, and they provide the therapeutic exercise aspect of it. Plantar fasciitis causes heel pain. What happens is you get tight tissue at the heel, and also tight heel cords and ankles can cause this stress and strain on the heel, causing a general inflammation in the heel joint. Now, from my end, the things I would do for this is, again, using things like anti-inflammatory medications. I can inject steroids into the heel. And then the therapist can look at the tissue itself and see where the tissue's tight, where the heel cords are too tight, whether the ankle muscles are not strong enough, and address those from a therapeutic exercise standpoint. So we kind of co-treat and attack the problem from two different sides, but we can be very effective for a very common condition. Now, for people that have never heard that word, plantar fasciitis, typically your heel hurts like heck. When you get up in the morning, it feels like you're walking on rocks. If you've been standing all day, you can't wait to get off your feet at night because your heels just burn and they hurt. And the condition is very treatable, though, and so, again, it usually requires a multimodal approach, using different approaches, injections, therapy, and medications to get it under control.
I see. So it's not just, or it is a foot, because I know that people go for that problem to a foot doctor, to a podiatrist, and he does all kinds of things from putting in arches, orthotics, and stuff like that. Does that have some value? Are you guys then doing that also in connection with it, or?
Yeah, we frequently use orthotics or cushions in the heels and the shoes to help with it as well. The podiatrists tend to look at this as a orthopedic type of issue where there's a heel spur, and frequently they will proceed with surgical interventions to this. And again, we're a non-surgical specialty, so we're approaching this from a non-surgical standpoint, trying to help you avoid going under the knife with this condition.
Oh, okay. So that's where a big difference coming again. If for some reason what a physical therapist does, or injecting some hormones and stuff like that, which you then do, if that combination doesn't work, there still always is the knife, but go and figure out the other first. Where if you go to a person who that's how he has learned to fix it with the knife, then that will be his first approach.
Yeah, there's no saying if all you have is a hammer, the whole world looks like a nail. And sometimes, that is the first approach people have. But I would like to say that, we do work very closely with our podiatrist colleagues, and it's never, for most of these conditions, it doesn't hurt to try a lot of things first before you look at surgery. And so if what we're doing doesn't work, then we can always send you to the podiatrist, and I do that frequently. We work with the podiatrist in cases sometimes people do need surgery, but there's a lot of things you can try first before you do go under the knife.
And you have a pretty good idea, I suppose, especially with your nerve testing in connection. I don't know whether you would do that for that, but I assume you would, the way since it shows you that something is out wacko. But you probably have a pretty good idea that, look, physical therapy very most likely potentially will help you, versus it's beyond. You gotta go and get it taken care of surgery. You probably have a good idea that there's a good chance, and you wouldn't go and put a person through several months of treatment if you don't see a chance at all because it's so bad.
I think for most musculoskeletal conditions, a trial of therapy and conservative care is usually warranted. And I think your point is really good. We usually know it's pretty obvious when you got an obvious surgical problem. Again, a tendon's ruptured, you got a broken bone, something's unstable. You know that needs to go on and see a surgeon. And we don't fiddle around and do things such as physical therapy when we really think you need to be on seeing a surgeon and possibly undergoing a surgical procedure.
Okay. All right. Well, thanks a lot again.